So for a breast augmentation, what that's going to accomplish is obviously a larger breast size, but also going to fill out the top portion of the breast, or what we call the upper pole. We typically do that surgery through an incision that goes underneath the breast at what's called the inframammary fold, or where the breast comes off the chest wall. The implant is placed underneath the skin and sometimes underneath the muscle as well, just to achieve a nice contour to the upper pole so there's not any rippling that you see. All the sutures that we use are ones that will dissolve on their own, and then we'll put a little bit of glue on top of the skin that usually peels off about 2 or 3 weeks after surgery. What I like to tell people about implant-based surgery is that right after surgery, they're going to feel like they are very, very high in your chest wall. They usually feel like they're up by your clavicles. But the reason that we do that is so that we know that in the course of the 1 to 2 months that follow surgery, as they settle down into position, they settle into the right place. We're kind of jumping ahead, but usually we will have you start the scar massage and implant massage at one of your follow-up appointments to help those implants settle into position to give you the nice result that you want. The recovery for a breast augmentation and a breast lift are fairly similar. Most of the time when I do an augmentation, I will place the implant underneath the muscle. That's typically, if you do enough reading online or talking with friends, what's described as a more uncomfortable recovery, but we do a block which numbs up the nerves that supply that area to help with the recovery. I also think that placing it underneath the muscle gives a nice coverage to the implant, so you're less likely to see any rippling for the implant, and it maintains the position a fair bit better. With regards to doing a breast lift or mastopexy alone, we don't have to do a lot of manipulation of the pectoralis muscles, so the recovery is a little bit easier in terms of pain postoperatively. We'll still do a block to help numb up those nerves initially after surgery, but we're not manipulating the pectoralis muscles, so there's that level of discomfort that we kind of avoid. That being said, full recovery is somewhat of a vague term. For you to feel as good as you feel now before surgery, I usually tell patients that's on the order of about 3 to 4 months after surgery. That being said, a breast lift, breast augmentation with a lift are all outpatient surgeries. So you're all having surgery and going home the same day. You're up and walking then, and it's a slow, gradual progression to that point where you feel as good as you do now. That being said, we do have some restrictions for after surgery, and the restrictions for, again, a breast augmentation, breast lift, or augmentation with a lift are all fairly similar. I usually have my patients refrain from doing any type of exercise for about 3 weeks after surgery. And then for you to be back to no restrictions, again, doing whatever you feel up to doing, I wait till about the 6-week point after surgery. But again, it's a gradual progression. And even at that 6-week point, if you feel like there are some things that you feel limited in doing, I don't want you to push yourself. I want you to listen to your body. Your body will tell you when you are able to do certain things. Some people progress quicker, some people progress a little bit slower. It's really on a case-by-case basis. So the incision patterns for these different surgeries are obviously different. With a breast augmentation, where we're just using implants to augment the breast, it's usually an incision just underneath the inframammary fold. It's usually about 5 centimeters in length and hidden at that fold so that once the augmentation is complete, that scar is hidden underneath the breast. With a breast lift, the incisions are typically more extensive. There's a range of what that can entail, but a good rule of thumb into what to expect after surgery is what's called the Wise pattern incision, or the incision that looks like an anchor. So the incision around the areola allows us to lift the nipple up to the most projected portion of the breast, and then the incision that goes down the front of the breast and underneath the breast allows us to drape the skin around the breast tissue or the implant that's in place. So in terms of incision patterns, there's a wide variety. Obviously, with an augmentation, it's more limited. Mastopexy requires more incisions, but it allows us more versatility in terms of changing the position of the areola and giving your breast tissue more contour, particularly of the lower pole. How you will scar after surgery is dependent on a few different factors. Some of those are controllable, some of those are not. The things that we can't really control are your personal history, complexion, family history, because genetics can play a role as well. What we can anticipate is that patients who have a darker complexion may have a higher risk of developing what's called hypertrophic or keloid scarring. That's not to say that it's a guarantee. The best indicator of how you're going to scar in the future is previous surgery or previous trauma. So if you've had surgery anywhere else on your body, similar scarring can be expected after a breast surgery. That being said, we're obviously going to try to do everything we possibly can to minimize the scarring that you have. Again, with a breast augmentation or with a lift, we have to make incisions to get the implant in place or to actually manipulate the breast tissue, so it requires incisions on the skin. Things that we can do from a surgery standpoint to help with the scarring is placing as little tension on those scars as possible. That typically requires closing the breast in multiple layers to reduce the tension and getting as nice of an aesthetic appearance to the scar immediately after surgery. After surgery, we'll have you do what's called scar massage to help keep the scars nice and thin. Obviously, we will show you how to do that after surgery to help minimize the scarring. There's also things that we can do beyond that. There are things like silicone sheets, there are things like injections of Kenalog or 5-FU if you start to develop or have a higher risk of developing that hypertrophic or keloid scarring. But obviously, that's something that we can talk about a little bit more in depth and talk about on a case-by-case basis to determine what's going to be best for you. So a very common question that I get with augmentation or with mastopexy is affecting sensation to the nipple areolar complex. The vast majority of patients don't have any change in that sensation at about the 2 to 3 month period after surgery. That being said, there are things that we can do during an augmentation that may affect it. Putting in a very large implant or dissecting in an inappropriate plane or too far can injure or partially injure the nerve that supplies most of the sensation to the areola. So again, that's one of the things that I would recommend talking with your plastic surgeon about if that's one of your primary concerns. Where the implant is placed, size of the implant, and the dissection plane are key things to keep in mind. With a mastopexy or a breast lift, we're obviously making more extensive incisions, so there's a slightly higher risk of damaging the nerve that supplies sensation to the areola. Again, it's something that your plastic surgeon will certainly take into consideration, and there are things that we can do to help protect that nerve. Obviously, it's something that is in the back of our mind constantly. But again, the vast majority of people at about 2 to 3 months after surgery have no change. There is a small subset of patients who will have increased or hypersensitivity or decreased or hyposensitivity following surgery. It's hard to predict exactly who's going to fall into that category. Again, it's a small minority of patients who will experience either hyper or hyposensitivity following surgery. Another question that I will commonly be asked about an augmentation or a breast lift is their ability to breastfeed after the procedure. Ideally, we would wait until after breastfeeding to do either of these procedures, but that being said, there are some patients who want to have an augmentation or a lift prior to that. That is not a prohibitive thing, but it's something to keep in mind that either one of these surgeries could impact your ability to breastfeed after surgery. I would say roughly 1/3 of patients will have some difficulty being able to breastfeed following these types of procedures, but that means the vast majority of patients are still able to breastfeed. Thinking about it as well, it's a bilateral procedure, so it's done on both sides. Your ability to breastfeed might be impacted on one breast compared to the other, or it might not be impacted at all. Again, the vast majority of patients, about 2/3, will still retain the ability to breastfeed, so I wouldn't worry too much about that. One key thing to talk with your plastic surgeon about if you are wanting to breastfeed following surgery is where the implant is placed, as well as the size of the implant. If that is something that you'd wish to do after surgery, talk with your plastic surgeon and we can talk about the differences in how those factors will play into your surgery. One key thing to keep in mind is that we want to wait a period of time after you finish breastfeeding to proceed with surgery. Obviously, we want you to have that attachment with your young one. We don't want to cut it too short because 1, we don't want to impact your ability to breastfeed in the future, but 2, we don't want to impact your results. We want to wait about 6 months, I'd say at minimum, before we do any type of breast surgery because your body is still undergoing those changes. There's still hormones circulating through your body. So at minimum, I would say 6 months between the time that you finish breastfeeding before any type of breast surgery. You obviously don't hurt anything by waiting longer, so waiting 1 year to 2 years after you're done breastfeeding to proceed with breast surgery might be even more ideal, but I usually tell patients at minimum 6 months between cessation of breastfeeding and any type of breast surgery. I'm Dr. Carlson with North Texas Plastic Surgery. I want to thank you guys very much for watching the video. If you guys have any other topics you'd like for us to cover, please don't hesitate to reach out. Please like, comment, and subscribe. Appreciate your time.